Radiology is an imaging services provider. We use a unique hybrid business model that is comprised of two components. The first component is an on-site component where we've got radiologists on-site at a community hospital. The second component is a care center here in our headquarters in Pittsburgh where images come to us and they're routed then to subspecialty radiologists, which result in a quicker turnaround time and also really a higher quality report back to the community hospital. The interesting thing about community hospitals is that they've actually always outsourced their radiology services. The difference between what we're doing now and what they've done historically, though, is pretty tremendous. The biggest difference is this. The biggest difference is that in the old days, they outsourced radiology services to a very small group of radiologists right down the road. It was a 2 or 3 person group, maybe a 5 person group, and they then supplemented that with services to read their evening and weekend studies. Those small groups don't have a major infrastructure. They don't have fail-safe in the event of something happening. Somebody gets sick, goes away on an extended vacation. It's hard to generate coverage. That was the old model. The new model is still an outsourced model, but it's a combination. It's a full-service model where they bring in people to put them on site, and they back that up with a group of specialists like we have in our reading center here in Pittsburgh. And what ends up happening then is orthopedic images get routed to a musculoskeletal guy. You know, a cardiac image goes to the right person, a brain scan goes to the right person. So you end up with very high quality reads. And this is different than the old model because in the old model, a lot of those radiologists were generalists and the community hospitals couldn't afford to have on site the subspecialists that we have here. Received JACO certification, which is recognition that our quality is systemic and something they believe can continue. We were the first radiology group in the U.S. to achieve that, and it's something that we're very proud of. The second thing is that those systems have resulted in our ability now to quantify for our customers exactly what our error rate is and to help them understand why these things have occurred and for us to work jointly to improve that. The American College of Radiology says that the miss rate for the average radiologist is about 4%. In our organization, it's less than 2%. The other thing that makes us unique in this regard is we talk about that 2%. We proactively send to our customers a report at the end of the month that explains everything that's gone on from 12 key metrics in their organization. Then we come out and we meet with them on a quarterly basis and we review with them all the quality issues that might have arisen during the prior 90 days. This is very, very atypical in healthcare and certainly atypical with radiologists. Well, when it comes to quality, quality is one of the keys to our value proposition. It's always been a big part of the culture here. The radiologists have been very focused on it since our founding. In fact, we are the first radiology group in the United States to achieve JACO certification, and that's something that we're extremely proud of. In addition to that, we've used the JACO certification process to kind of build out our quality processes around that. And what that's led to for our community hospitals is instead of reading at a rate where we've got 96% accuracy, which is what the American College of Radiology says we should have, we're operating at better than 98%. And that's a strong statement about the quality, and it makes a huge difference in the life of a community hospital because it allows them to differentiate their services and recruit other strong clinicians into their fold and to get them to admit to the hospital. Every company has a mission, and our mission is very simply to bring the best quality imaging services to the community hospital setting. That's our mission. Why is that important? Well, here's what happens today. What happens today is somebody has a problem, and they have a problem in Uniontown, Pennsylvania, which is 2 hours from Pittsburgh. It's an old steel town. It's hit on some hard times. The hospital's struggling financially, and the high dollar procedures, instead of staying in that local community and helping to enrich the hospital, which can then enrich the community, which generates jobs. So instead of keeping that money there, what ends up happening in many cases is somebody says, well, you know what, you're going to get better diagnostic imaging services if you go to UPMC. You're going to get a clearer diagnosis and a cleaner message on what's really wrong with you. And the truth is, that used to happen. That's no longer true. Okay, we have the absolute highest quality trained radiologists here, and they are reading instead of for a nationally renowned or internationally renowned academic medical center. they're providing reads to Uniontown Hospital, and they are giving absolutely the best quality in stunning turnaround times to people that have never seen this type of service before. And that, frankly, is why we're around and what we do for them.